Hi, and welcome to another segment of Top 10 Questions where we discuss the most frequently asked question with our doctors. Today we'll be discussing about the endoscopic sinus surgery. So doctor, the first question is, who needs the surgery?
I'm Dr. Diptarka Bhattacharyya and I'm happy to share with you the most common questions that we get as doctors. Now, sinus surgeries are some of the most common surgeries that we do in our practice. And out of every 10 people who walk into my clinic asking a second opinion for a sinus surgery, hardly 5 or 6 of them do actually end up needing a sinus surgery. So one of the most common things that I tell people is, let's talk about this, who does not need a sinus surgery. So if you're having one bad infection that is going on for 15 days, 20 days, you're having headaches, you've failed an antibiotic or a couple of them, you do not need a surgery. An active infection needs antibiotics and medicines to be treated. Sometimes I see people come in telling me, I have failed a couple of antibiotics, doctors have told me for a surgery. That is not a reason for sinus surgery. Number 2, you are pretty well for about 6 months to 7 months of the year, but maybe during the winters or maybe during the rains, it messes you up. You are sneezing all day, you're getting some headaches, you're getting some stuff, and every year it's those 3 months that really, trouble you. That's not a reason to get a surgery. So the reasons why people need sinus surgery is 1, they have symptoms pretty much throughout the year. Number 2, these symptoms keep coming back even when they've done medicines. That means you've done medicines, you're well for a few days, you stop the medicines, within about 3 to 4 weeks, you're back to the same place. Your nose is blocked, you're waking up in the morning, you're having a lot of sneezing, you are having sore throats, you're having headaches, you're having pressures, you feel tired, you feel a little dizzy sometimes. If these issues keep happening to you in spite of taking medicines, and when you're doing the medicines, you're okay or some improvement, but it keeps coming back every time you stop the medicines, that is the most frequent reason that people end up opting for sinus surgery. So that means that these symptoms must be going on for a long time and they must keep coming back even after doing medicines. That would be a time when we go for thinking about whether surgery will help you or not.
Okay, so the next question is, what is endoscopic sinus surgery?
Good. So this is another question that I get very frequently. So to understand endoscopic sinus surgery, let's just take a look at how sinuses work. Look, your sinuses are cavities inside your forehead and your cheeks. These are like upturned bottles. They're big inside and they're small where they open into the nose. Inside these cavities, we make mucus or bulgum or sully, whatever we call it. Not only do we make mucus inside this, but inside the sinuses, there are small hairs called cilia, as you can see here.
Sinuses are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose.
These cilia are continuously beating, and thus they're making the mucus flow like a river. They behave like a pump, and they make the mucus flow like a river throughout the day. That's why we keep needing to swallow after every few minutes. So every time you breathe, you're breathing in bacteria, you're breathing in dust particles, but this river of mucus is making everything wash away. Now sometimes this river of mucus can get blocked up, and it can get blocked up for many reasons. It can get blocked up by a bone that has bent inside your nose. It can get blocked up because the openings have got scarred out. It can get blocked out because of other reasons, like something is blocking it in the back of the nose. But irrespective of it, once that river of mucus gets blocked out, you keep getting more and more and more sinus infections because the bacteria gets more time in your nose to start infecting you. The problem with these sinusitis cases is that as you get infection, the bacteria starts damaging the inside walls of the sinus. So think about it. If your sinus is like a box and all the walls are covered with those small hairs, say the power of the pump is 100%. Now you have a blockage and you keep getting infections, and 40% of that wall is damaged by the bacteria and it has changed to scar tissue. What do you think has happened to the pump? Well, the pump has become 40% less powerful. So you already had a river of mucus which was not flowing well. But with these infections, it has become even slower. That means that with every infection, as the sinuses get more and more damaged, the chance of these sinus infections become higher and higher. And that is the reason for us to opt for an endoscopic sinus surgery, wherein we need to follow the problems and return the sinuses and the nose to a normal state, which is there in people who do not have sinus issues.
Okay, so the next question is like, what condition can be treated by endoscopic sinus surgery?
Okay, so as we discussed in the previous segment, Cruzy, you will see that endoscopic sinus surgery is basically returning the flow of the mucus to normal. So what are the issues that people have that get resolved by this? One, if they are having breathing difficulty because a bone inside the nose has slipped, that breathing difficulty can be completely sorted out by these surgeries. Number two, if they're having frequent colds, headaches, blockages, feeling like a pressure inside their head, that can be completely sorted. Number three, many of these patients find that they become very sensitive to dust and they've been told that you have allergies. But many of these people don't actually have real allergies. These are spurious or false allergies. It just seems like you have allergies because if you and me are breathing 10 dust particles, if my mucus river is good, then I'm also washing away those 10. But if your mucus river is not working, then out of those 10 dust particles, maybe 2 are going. So 8 of these dust particles are collecting inside the nose at every minute. So if you look at your nose and my nose after 10 minutes, you have got 80 nose particles. 80 particles of dust inside your nose, whereas I only have 10. So you may be having sneezing, you may be very sensitive to dust, but it is not a true allergy because your threshold is the same. It is not that you are reacting to less particles by an allergic reaction. It is just that effectively, even if we breathe the same number of particles, you are reaching that threshold way earlier than someone else whose mucus river is good is reaching. So in those situations, those allergic symptoms will go completely or 90% after these kind of surgeries. There are multiple other things that can be sorted. Sometimes people will have very frequent sore throats wherein they cannot drink cold water, they cannot drink anything sour, and that many times is thought to be because of pharyngitis, but that is not true. It is because this mucus collects in your nose, and when you lie down, that mucus drips down your throat, it irritates the throat, and that's what makes the throat sensitive. If these issues are there, these can all be sorted out because of by sinus surgery. But pure allergies will not be sorted out. This is something that must be told to patients before the surgery.
So what are the advantages of endoscopic sinus surgery?
Okay, so the main advantages of endoscopic sinus surgery are the success rates and the long-term success results. In these surgeries, it is not 50% or 60% success. In most high-volume rhinology centers in today's day and age, the success rates are above 98 to 99%. And these surgical successes carry over beyond 10 to 15 years. And you have to understand that it is fundamentally because of physics. This is a situation where your doctor is not changing anything in your body. This is not a place where I've made a new hole inside your throat that will try to close up. I've made a new hole in your stomach. It will always try to close up. Here, all that the doctor is doing is removing the obstructions, removing the problems. So the reason why you get long-term results in this is because once this is sorted, your body effectively returns to a normal body. So a properly done endoscopic sinus surgery is very stress-free as a doctor and as a patient, because once you've finished it, you know for a fact that this will not fail. Except for very rare situations, which we usually look at before the surgeries, but in 99% of cases, I know that when I've finished the surgery, whether it's going to work or not. The other big advantages of endoscopic sinus surgery is that it is extremely safe. In today's technology that is available, the chances of any complications in endoscopic sinus surgery becomes less than 0.1%. So it has become one of the safest surgeries that is done across the world. And the number 3 thing is that this as a surgery is completely painless and completely cutless. That means that this surgery can be done at any age group, and once the surgery is done, you can go home without any kind of dressing. You go home the next day looking like how you had come in. Once you go home, you have no restrictions. You can take normal head baths, you can eat any food, you can go out, you can join your office from the 2nd or 3rd day. So there is really very little downtime. It is very safe, and it gives us very guaranteed long-term success. These would be the primary advantages that modern endoscopic sinus surgery has.
So along with the advantages, I'm sure there will be disadvantages too. So what are the disadvantages of endoscopic sinus surgery?
Okay, this is one of the common questions that people ask me, that okay, so you keep talking about the good things, you're a surgeon, so obviously you'll talk good things about it. Not true. It is not my job to overplay or underplay any surgery. If a surgery is risky, then the reward has to be worth it. That means if someone has a cancer, if it's a risky surgery, I still have to do it, because if I don't do it, this is life-threatening. But if your problem is that you've got headaches, you're miserable, and the surgery itself is risky, then it is not worth it for me as a surgeon also to recommend the surgery. The primary disadvantages that I see is failures. And I just told you in the last segment that this is an extremely successful surgery. But still, in India, if you ask 10 people, at least 3 or 4 people will tell you that, oh, don't do sinus surgeries, they fail. And it is true. So if sinus surgeries are failing in the common perception in India, but they're successful across the world, you have to think about why they are failing. And I'll tell you the top 3 reasons why I see failure surgeries which I have to improve on or revise or fix. The most common 3 reasons are: 1, improper patient choice. I very frequently see patients who have an issue of either allergies or something like that, which is not at all surgically treatable, which has been done a surgery for. So if you do a surgery for a patient whose problem is not a physical issue, that means there is a bone that has bent, there is a scar tissue that has happened, something that is touchable, that is something that you can remove, that surgery is doomed to fail. So improper patient selection is number 1. Number 2 is improper surgery. Look, the biggest problem with endoscopic sinus surgery is it's all or none. You either don't do it or you do it perfectly. The most common reason that I see these issues happen is because doctors are scared of going close to the roof of the sinus, which is also the base of the skull. And they're scared of going to the side of the sinus, which is the joining wall between the sinus and the eye. So they will leave scar tissues on the roof, and they will leave scar tissues on the side of the eye. The problem here is very frequent and very obvious. If you leave scar tissue, you may do well for a few months, but eventually that scar tissue will keep on growing until the problem comes back. So if you're opting for a sinus surgery, there is no partial surgery in sinus surgery. If you're going for it, as a doctor, we have to fix all the problems. So the way I talk about it is that sinus surgery is like dominoes. So if you push one domino, you've seen how tuck, 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 4 or 5 of them will fall. It's the same thing. So when someone has a sinus issue, usually it is number of steps. That means a bone has bent, which has blocked the sinus, which is causing them certain other issues. So as a doctor, my job is to understand the pathway of the problem and to fix each one of these problems. Once these problems are fixed, these issues do not come back. But a partial surgery in sinusitis is doomed to failure. And number 3 is improper follow-up. That means that when you do these surgeries, your patients absolutely need 2 or 3 follow-ups, because the sinuses get some crust when you've done the surgery. And these crusts need to be removed until the patient has healed. Now, if the crusts are not removed, the patient or the doctor, they have not done the correct follow-up, what happens is these crusts can get infected. If these crusts get infected, they will cause scar tissue. If there is scar tissue, then we are back to square one. So if you do a proper patient selection, proper surgery and proper follow-up, the chances of failure are very less. But if these things are not followed, then we do see these things to recur.
Okay, so the next is how is the healing period after this endoscopic sinus surgery?
Endoscopic sinus surgeries are painless surgeries because there are no cuts on the skin. Now, once our patients have the surgery done, when they go home looking like normal. There are sometimes 2 small plastic splints inside the nose which hold the nose in position. But that is not visible and that doesn't cause you any pain. The nose is a little blocked for the first few days, like a little bit of a cold, and you do have to spray the nose and clean it out a couple of times at home, but you can do pretty much everything. At 1 week when patients come in, we remove those plastics and we do a thorough cleaning. That 1 week mark is a great time because that's when you feel like your nose has changed. During the 2nd week, you keep on getting better and better and better. I like to see my patients one more time at 3 weeks. That is for my final check and to make sure that the healing has completed and it has gone without any issues. But after 1 week, our patients mostly feel great, and it's usually by the time they come to see me at 3 weeks, it's just a check, maybe 1 or 2 small crusts that need to be removed. That's usually how the healing goes.
So what is the success rate of this endoscopic sinus surgery?
This we have already discussed, and as I've told you in the previous segment, a properly done sinus surgery is about 98 to 99% successful across the world. But the big key word here is properly done, because a 60% done sinus surgery is not 60% successful. It is bound to fail. So you either do 100% surgery or do not go for a surgery. The other issue is that sinus surgery is the first sinus surgery is the best chance that a doctor has and a patient has to get better. Because if I have to do a revision when I'm doing the 3rd or 4th sinus surgery, it is very hard for us to get great results, because by the 4th surgery, all the sinuses have changed into scar tissue. So multiple sinus surgeries usually don't give us good results. So the first surgery is very important and it has to be done properly.
Is endoscopic sinus surgery a laser surgery?
No. This is again a question that I've asked sometimes by patients, but you have to understand laser is just a tool. Laser is a tool that is used to create a lot of heat in a specific area. We use lasers in larynx surgeries or voice box surgeries, ear surgeries, certain places in the nose, but generally the sinus surgeries are not ideal surgeries for laser. And the reason is obvious, because in sinus surgeries, we want no heat, because right next to the sinuses are your eyes and right above it is the brain. So we actually want less heat rather than more heat. So what we normally use, the latest techniques that are used are some things called debriders and coablators, which basically remove tissue with minimal heat generation, which is what is a standard of care across the world. But lasers are used very infrequently or mostly not at all in these kind of surgeries.
So can the problem come back after this endoscopic sinus surgery?
So I think we have already discussed this in the previous question. A properly done endoscopic sinus surgery is one of the most successful surgeries that I do as a rhinologist, and this is something that is true not just for me, but across the world. High volume rhinologists, we're doing a large volume of these cases. Properly done endoscopic sinus surgeries are some of our most successful surgeries. The patients who get them are some of our happiest patients. These are the people who leave who find the doctors on social media and leave reviews and feedback and glowing words and stuff. And it's hard to understand why, but people who are suffering from these chronic sinusitis issues, it is really miserable. There are studies that show that these patients, their scale of suffering is same as a chronic kidney disease patient. Because think about it, you wake up 15 days out of a month not knowing if you're going to have a headache or not, not knowing if you'll be able to work or not. If we have a cold for 1 week, it really throws us down, it bumps us out. Now imagine having this month after month after month. You know you're going to fall sick, you just don't know when, and you don't know how to stop it. So people who get sinusitis, many times I hear people say, oh, this is just a sinus, why do you want to go for a surgery? That means you have never suffered from chronic sinusitis, because for a patient who's suffering from chronic sinusitis, sinus surgery is a life-changing thing, and it is one of my favorite surgeries, because it really it's amazing to see our patients after these surgeries.
So the last question for this top 10 question is like, are there any long-term restriction after endoscopic sinus?
Absolutely not. Absolutely not. The only one restriction that is absolutely critical, and if people do not follow it, I don't do surgeries for that, and that is smoking. Okay, now we're all human. You need to have a social life, so you go out, have a couple of drinks. From this surgical perspective, it is not going to cause any problems. But smoking is an absolute thing that will cause you to have failure, because smoking destroys the linings and the layers of the sinus even without any physical blockage. So if you've gone through the surgery and I have taken the trouble to do the surgery, I want you to get the results and you want to get the results. So unless you are ready to give up smoking, you should not go for a sinus surgery, because I can write it out and give it to you that your sinus surgery, whether it is done by the best sinus surgeon in the world or not, it will fail. So if you're considering a sinus surgery, first give up smoking, make sure you can stay off smoke, and then think about sinus surgeries. Apart from that, everything else is okay. Not much restrictions with flying or any of the other things. Only thing is, if you're living in a very dry or arid kind of weather, you may need to use a little bit of nasal moisturizers and stuff. But that is true for many people who don't have surgeries and have nasal dryness also. That's basically taken care of on the basis of how you are doing.
Thank you so much, doctor.
Okay.
These are top 10 questions.
So that was a great topic, and these were the most common questions that we get. If you have any further questions about sinus surgeries, please feel free to WhatsApp us or connect with me on email IDs, which should be here somewhere on the screen. And we'll see you soon with another segment of Top 10 Questions. Till then, take care, and thank you for joining us on this. I'm Dr. Bhattacharya, Crusadni, and we are Dr. Bhattacharya ENT. Namaskar.